Again, very warm welcome. We're delighted you could join us today for what promises to be a very, very engaging webinar and a timely one indeed, titled The Flu Vaccine and COVID-19, What People with Chronic Illness Need to Know. We're very grateful also to be joined by an expert panel today, and I'll introduce our speakers very soon. I know we're all very eager to dive right in, so I won't take up very much time here, but just for some context, at the Global Healthy Living Foundation, we have now been conducting these educational webinars for over a year now with the commitment and principal aim of bringing cutting-edge research, mainly in rheumatic and musculoskeletal conditions, to our communities of patients across the country. Many of these webinars, like this one, are conducted in partnership with a group called the Autoimmune Research Collaborative, or ARC for short, which includes other patient-powered research registries we partner with and collaborate with in disease-specific areas like IBD or inflammatory bowel disease, MS or multiple sclerosis, and vasculitis. So special thank you to our collaborative research group as well. My name is Shilpa Venkatachalam, and I am the Associate Director of Patient-Centered Research at the Global Healthy Living Foundation, and I'm also the co-principal investigator on Arthritis Power. I'll be your facilitator for today's webinar. So before we can dive in, let's just go through some very quick housekeeping rules. So all audiences are placed on mute throughout this webinar, and the principal reason we do this is because we're recording these webinars. So for those who are not able to attend the live session, we want them to be able to access this information later on, and we post these webinars on the Creaky Joints website. This helps us maintain a good quality audio recording and avoid any sort of background noises. We want to make this interactive, so we do encourage your questions throughout, which you can send to us using a questions box. You should see on your panel and on your screen a little gray box with an arrow that says questions, and you can send your questions to us at any point during this webinar. These webinars are meant for you, so please, by all means, send your questions at any time to us. We're going to try our very best to answer all your questions, but we do unfortunately have only 1 hour, and so we apologize in advance if we're unable to get to your questions. I promise you we'll find a way to get back to you, though, if we're not able to get to your question during the live webinar itself. So a little bit then for today's webinar. Like many of you, I too live with a chronic condition, rheumatoid arthritis, and for many of us, the upcoming flu season is especially daunting this year for so many reasons. We've heard it many times by now, the assertion that this year's flu shot is more important than ever. And some of our discussion today will explain why this is the case. In general, for people living with chronic conditions, the flu vaccine is indeed important to get. This year has been especially tough because we're also living through a pandemic, which has by now unfortunately impacted all of us in some way or the other. Given the possibility, unfortunately, of a twindemic, we thought it's important to address some dangerous but widely circulated myths about the flu vaccine, and also talk about how to safely get your flu vaccine so that you can continue to stay safe and keep others around you safe as well. So with that, I'm very, very excited to introduce our distinguished panelists for today. You might have seen them on the video, and thank you for switching on your video. We have with us today Dr. Iris Navarro-Millan, who is a rheumatologist at Weill Cornell Medicine in New York, with current appointments at the Hospital for Special Surgery and New York Presbyterian. Dr. Navarro-Millan also worked relentlessly during the summer peak of the pandemic in New York, and we thank her for her service. In fact, she was also recently featured in a New York Times article titled "How COVID Sends Some Bodies to War with Themselves." We'll share all this information with you on the website on Creaky Joints as well. So again, very warm welcome to Dr. Navarro. Our second panelist, Dr. William Schaffner, is the Medical Director of the National Foundation for Infectious Diseases and Professor of Preventive Medicine and Infectious Diseases at Vanderbilt University. He might look familiar to you, so you might have seen him and his many interviews on televisions over the past few months, during which he has been providing guidance and counsel to the nation on how to stay safe during this very challenging time. Welcome, Dr. Schaffner. Finally, we're also joined by Tasha Polster, who is the Vice President of Pharmacy Quality, Compliance, and Patient Safety for Walgreens, where she oversees the retail pharmacy immunization program, pharmacovigilance group, and the Walgreens Patient Safety Program. Through her work, she has continued to put into place the highest standards of safety for patients across this country, and for that, we thank her as well. So again, very, very warm welcome to a very distinguished panel today. And with that, I'm happy to hand this over to Dr. Navarro. So Dr. Navarro, please take it away.
Thank you, Shilpa. Thank you for that kind introduction, and I'm delighted to be here talking alongside William and Tasha about the importance of the flu vaccine. Thank you to Arthritis Power. And thank you for your time to just sit here and listen to us. So hopefully you will find some information interesting. Please, next slide. These myths are very well articulated because these are some of the things that we encounter as part of the discussion that we have with our patients. So one thing that I get asked quite frequently in clinic is that if I don't get the flu shot vaccine, the only person it affects is me. And that is not true. By getting a flu vaccine, you are protecting yourself, but you're protecting others. This is pretty much what happens when everybody wears a mask and somebody doesn't. Then the people that are wearing the mask are still protecting that one that is not unnecessarily that is not wearing the mask. So similarly occurs with those that get the vaccine. So even if there are a few people that do not get the vaccine, the virus cannot make it into the population. That is what herd immunity is. So getting the flu vaccine can help also save valuable COVID-19 medical resources. And by that, what we mean is that during the peak of the pandemic, one of the challenges that we had, particularly here in New York City, where I work, is that we had to put two patients in one ventilator. We had to share ventilators. There was resources running out. So if we have now patients coming with COVID-19, patients coming in with the flu, and patients coming with both, then that can put in a very can put the healthcare system in a very stressful situation that we need then to be forced decisions like who are we going to provide the next ventilator or not. By getting the vaccine, this is one of the things that you will be helping with. So another aspect about this point is that if you get the flu shot, you can shorten also the amount of time that you're contagious and also less likely to infect others. Next slide, please. Another myth number two, I shouldn't get a flu vaccine because I have a chronic condition. Actually, the entire opposite. We know that patients that have pre-existing conditions, not only rheumatic conditions, but also hypertension, asthma, diabetes, are at higher risk. So getting the flu vaccine can actually prevent these complications. Or even if you get the flu, you get mild symptoms. So the recovery time from the flu will be shorter in case that you still get the flu. You may need to also stop your medication to get the flu, as some studies have shown that in patients with autoimmune diseases like rheumatoid arthritis, what happens is that stopping some of the medications that we use to treat rheumatoid arthritis can help boost the response and the immunity that we build against the flu, because we are able to develop more efficient antibodies in response to the vaccine against the flu. And yes, that thing that I think covers the last bullet about this one. Please, next slide, please, or myth number three. I shouldn't get I am healthy, so I don't need the flu. So as we know, let's put an analogy with COVID-19. Healthy people and people that are asymptomatics and children are not necessarily having some symptoms, but are spreaders. So in the case of people that are healthy, that you might think that you might not get it, you can get it and you can spread it too. So being young, being healthy is actually still an indication for you to get the flu vaccine. Um, so even though the vaccine might not be completely efficacious, even partial protection is important. And remember, we are not here alone. We are also working with our communities. So we want to protect others as well. Next slide, please. So for this slide, the point is that the flu vaccine will give me the flu. That is probably the most common question that I get among patients that are hesitant. And probably even those individuals that now agree to take the flu vaccine every day, at some point, they always have this concern. And so let's go over the bullets in this line and I give you some explanation in the middle. So the first point is, besides the nasal spray, flu vaccines are made from an inactivated or dead virus. So what that means is that if the virus is dead, then you probably not you can't get the flu because the viral is inactivated. Now in the activated form, there is a higher risk of developing the virus because the virus is not totally killed. So that is why in patients with chronic conditions like autoimmune diseases, rheumatic diseases, we want to use the inactivated vaccine. And it can take up to 2 weeks to build protection against the flu. But this is very common, and this happens also in children. You probably don't remember. I remember when I got some of my vaccines as a child, my mom giving me Tylenol before I got to get the vaccine because sometimes they say, oh, she might have a little bit of fever the next day. Same happen as adults when we get the flu. So some people might feel achy, tired. Some people might have a little bit of fever after that. But that is the immune system. That is not that you're getting the flu. So be mindful about that. Sometimes it's just that saying that your immune system is actually working for you and working in your favor by developing some of these symptoms. Okay, next slide. Excellent. Um, I am isolating, socially distancing, masking, so I don't need to get the flu vaccine. Um, Socially distancing and masking can still increase your risk because the mask is not 100% uh, is not perfect, and also socially distancing sometimes is not that efficient. You go to a restaurant that is outdoor but it's not really 6 feet as recommended, and you might not be able still to isolate throughout the entire season. We have been isolated for how long? Since probably end of February, some in March, and now you're going to isolate yourself for 6 more months. So getting the vaccine is extraordinarily important because you protect yourself and you protect others, and we should not take this issue lightly, especially in the setting of also having a pandemic like COVID-19. So COVID-19 cases may drop in your region before the flu season is over. So we still have the risk for the flu even after the COVID-19 cases drop. But so far we're seeing that both viruses are rising. So even more important to get the vaccine. The flu vaccine might protect you also in future flu seasons because some of these, the more you get the flu vaccine over the years, the more immunity you get to the flu. So even some people, some elderly people that got it in the 70s or in the 80s and not recently getting it now, they might still have some immunity from those times. And we learned on that from the H1N1 pandemic in 2009, where some older people were just like doing okay, and it's because many years earlier they did get the swine flu vaccine that was developed back in the 70s and 80s. So that was a thought. The risk of getting infected with COVID-19 during a trip to get the flu vaccine is fairly low also, especially if you're protecting yourself with a mask and some other personal equipment like gloves or even some goggles and glasses. So get the flu shot is nothing to lose, so much to gain, and so little to lose for you, for your family, for your community. I think now I'm going to pass it over to William Schaffner. Is that right?
Yep, that's correct. Dr. Schaffner, on to you.
Thank you. So here's myth number 6. I don't want to put chemicals in my body. I can boost my immunity in natural ways. Actually, although diet and exercise are excellent, and there are laboratory data to suggest that aspects of the immune system are improved, there's absolutely no scientific evidence that diet and exercise alone will protect you from influenza. And experience ought to tell us that Olympic athletes can get influenza if they are not vaccinated. Vaccines today include an array of ingredients in addition to the vaccine itself. They stabilize the vaccine. They're all carefully tested. They are safe. Each ingredient does serve a specific purpose, and together they produce the vaccine. And so it's clear that the vaccine as a whole will be both safe and effective. Could I have the next slide, please? Oh dear. Excuse me. My goodness. Myth number 7 is that vaccines, including the flu vaccine, cause autism. That's clearly not the case. A study was done in 1998 that was presented in the Lancet. It was done by a very charismatic physician, suggesting that there was a relationship between measles, mumps, and rubella vaccine, particularly the measles component, with autism. An investigation of that study showed it to be, first, incorrect. It's never been repeated by anyone else. They could not replicate these results. And indeed, not only was it found to be erroneous, it was found to be fraudulent. And so that physician actually lost his license to practice in the United Kingdom. This was done in England. There have been many studies to show that vaccines are not associated with autism. That's clearly incorrect. And I would wish that that myth could be permanently put to rest, because unfortunately, we still hear about it. I'm still having some technical difficulties. Is there someone who could help me? Thank you. So I got the flu last year. Why do I need another one this year? There are 2 reasons for that. The first is that the influenza viruses mutate. That is, they change. And so the influenza viruses around the world change each year to some degree, and the viruses, the vaccines must be kept up to date. As we're keeping the vaccines up to date, therefore a new immunization must be done each year. And then the other reason is that the protection we get actually wanes a bit over time. And so that by the time the next year rolls around for flu, we all need another vaccine. To the next slide, please. You can't get flu and COVID-19 at the same time. I'm afraid that's incorrect. That's also a myth. We don't have a lot of experience yet, but there already are case reports of people who have had both influenza and COVID-19 simultaneously. That sounds very, very sad. Now, these are people who were already in the hospital, very seriously ill, and so they were studied most carefully. And so we think probably the 2 of those infections simultaneously probably do cause more severe disease. This is a phenomenon that we will study more completely as we go on down the road. But getting vaccinated against influenza, of course, is the best way that we can prevent this prevent at least half of these occurrences. So it's important for that reason, and also to take some of the strain off the healthcare system, because we know that each year influenza in and of itself can put a lot of strain on the healthcare system. The next slide, please. So what are the differences between these two, or the similarities? What you need to know is that these are two viruses that can present in very similar ways. They are going to present many challenges to individuals and to we physicians and other healthcare providers going on into this, what we anticipate will be a twin-demic season, where we have both influenza and we have both COVID going on at the same time. Distinguishing the two is going to be very difficult. Once again, getting vaccinated against influenza, you remember the recommendations. If you're 6 months and older, you should get vaccinated against influenza. That will help make it less likely that you at least get influenza this year. Next slide, please. We have tests that can test us against influenza, and we can also do that against COVID. Both of these tests have limitations. They're often very useful. Their interpretations have to be a little bit guarded. And indeed, in the middle of influenza season, many physicians would rather treat you for influenza than do the test, because the tests do have some limitations. Sometimes the tests are negative, but you do have influenza nonetheless. It's just in the nature of the test. There are a number of different vaccines that are available. The first on this list is a live attenuated vaccine, which is administered by nasal spray. That's available to everyone from age 2 to age 50 who's otherwise healthy. It's used dominantly in pediatric practice and among adults who don't like to have the inoculation. Most of the vaccines today are quadrivalent. Almost all of them are. That is, they protect against 4 different influenza strains, 2 influenza A strains, and 2 influenza B. The trivalent vaccines protect against 2 A's and 1 B. We also have 2 vaccines that are licensed specifically for people age 65 and older. A high-dose vaccine that actually has 4 times as much vaccine in it as normally, and an adjuvanted vaccine. An adjuvant is an immune stimulant. So it revs up the immune system so that it responds better to the vaccine. Both of those vaccines have been shown to work better in people age 65 and older, and at least in my neck of the woods, here in my institution, physicians are recommending one or the other of those vaccines for people age 65 and older. The next slide, please. Where to get a flu vaccine? I think that's now passed on to my partner.
So you might be wondering where should you go to get a flu vaccine? And of course, the answer is you can only go to Walgreens to get a flu vaccine. Just kidding. That's a myth. But if you go to the next slide, I think there are so many places now where you can get a flu vaccine, whether it be your doctor's office or a healthcare center. Every pharmacy has flu vaccines, and urgent care centers. But there may be other areas in your community that you can look for, because many pharmacies will partner with other places as well. So I'll give you an example. Walgreens will partner sometimes with churches and communities, particularly in underserved areas, so that we can provide flu shots whether you have insurance or not. So you can always check throughout your community to see if there's places available to get your flu shot that might be convenient. But going into a pharmacy, there's drive-through options. Some retailers are having. There's curbside clinics as well as mobile outreach units. I've seen examples where retailers have buses that they drive around to communities. You can always visit vaccinefinder.org to find what's available near you, or, of course, the Walgreens.com website will also have, options for you, or you can talk to your local pharmacist. The good thing is you're not confined when you're able to go to a pharmacy. You're not confined within the 9 to 5 hours of your doctor's office, and it does help take some of the burden off of the physicians. If they're busy and you can't get an appointment, you're able to go into a pharmacy during all hours, nights, weekends, holidays, whatnot. When the pharmacist is there, you can get your flu shot. Next slide, please. So you might be worried a little bit about safety because, there's lots of talk now about social distancing and making sure that, you're staying 6 feet apart. And how can we be 6 feet apart if the pharmacist is standing right next to me, or the doctor is standing, or nurse is standing right next to me giving me a flu shot? But know that, the CDC has put through guidelines of the best way for the pharmacy staff to do a flu shot safely and keep you and the employees safe. And, Walgreens, I can speak specifically to, has exceeded the safety precautions by requiring a mask for all of our employees, a surgical mask. We require the patients to wear a mask, and if they don't have one, then we would provide one. We also take the temperature of the patients. If they would like to get a vaccine, we want to take the temperature. We ask all the safety questions, making sure that they're not feeling ill. And if they are having any of the signs of feeling ill, we ask them to come back when they're feeling better. But, between the social distancing, the hand washing, additionally, our pharmacists are given face shields to wear, just as an added layer of protection, just to make sure that we're doing everything we can to keep people safe. But I cannot echo enough of how important it is to get you and your family vaccinated for the flu this year more than ever, because of the potential convergence of the flu and COVID happening at the same time for the uptick that we're seeing now. It's honestly our responsibility in our communities to help take the burden off the healthcare system. If we know that we can prevent it with a vaccine preventable, if we can prevent an illness through a vaccine, there's no time like now to go get one. And it does take 2 weeks for it to take effect. So you want to get it sooner rather than later so that you're protected and you're protecting the ones that you love.
So thank you so much to all three panelists for that fantastic information, very timely information as well. And, just to sort of recap here, what we're hearing unanimously from all three of you is encouragement to go get your vaccine, your flu vaccine immediately. Of course, speak to your doctor. We always encourage patients to speak to their doctors about specific medical information. But the unanimous sort of message here is to protect yourself, protect your others, and get the flu vaccine, especially this year, but every year. We have, as you can imagine, we have a ton of questions coming through, so please keep them coming, and we'll get right into the question and answer session here. And why don't I start with our first question for Dr. Navarro. So, Dr. Navarro, I suppose the first question that comes for you is, there's a lot of questions coming in about what the best time to get vaccinated against the flu is. And if I can add to that, I suppose what patients are really concerned about is, we often talk about the flu vaccine as being protective for a certain period. This is also why we get the flu vaccine over and over again each year. So what is the optimal or ideal time for patients to get the flu vaccine so it sort of protects them throughout the flu season? Dr. Navarro?
Hi, can you hear me?
Yep.
Okay. So I think what study has shown is that by February, March, there's still some cases of the flu still lingering around. So you want to still have some of this immunity against the vaccine. So if you got your vaccine in early September, some of that immunity that you have built might have faded away. So that is why they recommend between mid-October, late October to be an adequate time to get your vaccine so that you will have the strongest immunity for the duration of the season. So if you haven't got it right now, this is the right time, because we are about to start November. So this is the right time. And if you got it, it's still good. I actually got it as soon as it got out, just because I had it in my mind and it was easy to get it out of the way. So don't worry if you got it also in September. You will still have coverage and good coverage for the entire season. It's just that it's probably towards the last tail of the season. It might not be as strong as it was during the peak, but it will still cover you during the peak time of the season. So I want to clarify something also that I said earlier and that Dr. Schaffner also touched on, and is that previous year's vaccines, they do protect you even though some of the immunity goes away. So there is, they cannot get it right every year. So I just wanted to correct, because for the H1N1 comment that I made earlier, there were some suggestions that even some of those vaccines that you have gotten years ago might still protect you, but that doesn't preclude the need for getting a yearly update. So I just wanted to clarify that because I thought that what I said was a little bit contradicting to what Dr. Schaffner said, which was really well said and articulated.
Thank you. That's great. And thanks for clarifying that as well. And your answer sort of calmed my nerves as well, because I got my flu vaccine as well early on. In fact, my rheumatologist was the one who encouraged me to get it at my appointment. So thank you for that. I'll move to you, Dr. Schaffner, for the next question. A lot of people, of course, you talked about the twindemic this year. Do we know, or do we have any sort of information or data coming in on what happens if someone gets both the flu and the COVID and COVID-19 at the same time? Could you talk a little bit to that?
Surely. There have been case reports, as I said, of fairly seriously ill people who have had simultaneous infections with COVID and influenza. We haven't studied very many people. We don't know how frequently that occurs and whether it always makes you very sick, but it doesn't sound like a good idea to me. And I certainly would like to try to prevent the influenza part of the equation. Now, as we go along, now that we're starting to have COVID and perhaps some flu together, I'm sure that academic institutions, not only in the United States, but around the world, will be looking more for whether you can have these two infections occur simultaneously and how frequently this occurs. So we will learn more as we go along. But certainly get vaccinated against influenza. That will help prevent at least that part. And of course, everything else we do to prevent COVID, the mask wearing, the social distancing, good hand hygiene, avoiding large groups, that will help us prevent influenza also. But it's not enough. You've got to get your vaccine too.
For our next question, a lot of people, as you mentioned, are very scared, and rightly so, to go anywhere outside to a public space, including pharmacies, etc. And you talked about, there's so many different things that you put into place for people to be able to get their flu vaccine safely. Could you talk a little bit about what, for example, a drive-through, getting vaccinated at a drive-through might look like? And are there also possibilities to sort of call ahead and make an appointment at a pharmacy such as Walgreens what could you talk a little bit about that as well in terms of
Sure.
safety procedures?
Sure, absolutely. So yes, we do have an appointment scheduler on our Walgreens.com website where you can make an appointment. You can also call ahead. And then depending on the store and where the store is located, you may see some signs that the store is advertising that they're going to have a flu clinic outside. We do ask for the select sites that are doing those kind of flu clinics. We are asking though that the patients they we have to make sure safety's got to be number one. And so you can't just get a flu shot and drive off. We want to make sure that you're not going to have any type of reaction to a flu vaccine. So if we do a an outside drive-through, sometimes it's in a tent where you would get out of your car and go into the tent area and sit with the pharmacist, get your flu vaccine, and then you can get back in your car and leave, within 15 minutes or whatever. But the main thing is that we want to make sure you're safe at all times, not only from COVID, but also just in case there's any type of medical emergency. We don't want you behind the wheel, driving off if something were to happen on the very, very rare instance that you might have a reaction.
So yes, Yuris, I see that there's a lot of questions coming in through chat as well. And I will come to those. There is a lot of different questions, but I wanted to first ask you about, we imagine this scenario where we go into the doctor's office with symptoms. What is the protocol? How do we know if it's COVID or flu? How does the doctor make that decision?
That is an important question, but I think that I would like also the rest of the panelists to comment a little bit on their views on this. So the way that we have organized things is that you really cannot tell until you get a test. So there are several things, like Dr. Schaffner said. You can just get started and just right away on Tamiflu, something like that for the flu. But if this is something like COVID, I think the best way to tease this out is by getting tested. And this is a little bit different than what we would do in other years, because if you have COVID, you need to be isolated and maybe even trace whoever you had contact with. So since the symptoms are similar, especially the mild symptoms, we think that you should be tested. And I know that there is a risk of even going to get tested, but now some testing locations in your communities might be already set up. And that is what I would advise. Even in New York City, here the testing facilities keep changing all the time. So what is the nearest one? So there are updates that the city is providing. Get involved with your community. Find out what is the best testing service. What is their protocol? How is their protocol? Find their hours. So in case you get sick, you know what to do and get tested. But I hand the microphone. I would love to hear what Dr. Schaffner and Tasha have to say on that question.
Well, let me go first, and then I'll hand it over to Tasha. I think a lot might depend upon how much influenza there's in the community right now. For example, here in Nashville, we have no influenza, essentially. So if a person comes in with respiratory symptoms, they would be recommended clearly for COVID testing. And we do have testing sites, not only here in the medical center, but around in the community. So they're much more available now than they once were. Once we have a great deal of influenza, if we do, in our community, then I think many doctors may just go ahead and treat you as they do every year without testing. They'll just go ahead and treat you. On the other hand, patients this year, more than ever, will want to know, do I have flu? Do I have just a cold? Do I have COVID? And so I think we will be, just because of patients' request, doing a lot more testing. And we have to know that each of these tests, depending upon the type of test we use, has certain limitations. I don't think it's going to be an easy winter season for any of us. Tasha?
Yep, I would exactly agree and echo what both of you said. It's going to be a tough winter this year. I do think that patients are going to be very curious to know whether or not it's flu or COVID, and worried, more worried if it's COVID than it is with flu, just because of, treatment and, all the scary stuff that's happening in the news. I think everything's very heightened this year. And I do agree that the testing is going to be important. And there are lots of testing sites available. As you were saying, they have expanded. Walgreens also has testing sites in select locations, and that's available on our website. So in addition to your community, you might be able to find it in your, on your community websites that tell you that you have testing at certain schools or churches or whatever. It might be convenient for you to try your local Walgreens or get on the website and find it that way.
Great, thank you so much. Another question about the high dose vaccine. A lot of patients, questions are coming in about whether the high dose vaccine is the right one for someone with an immune system issue, so with an autoimmune condition, for instance. And Dr. Schaffner, if you could take that. And for Tasha, the second part of the question is the high dose vaccine is generally given to people over 60 is what patients say they hear, but if they go into a pharmacy, are they able to avail of a high dose vaccine even if they're under the age of 60? So I'll turn it over to you three.
Well, I can start, and then Dr.
Yes.
Schaffner, you can
Go
weigh
ahead.
in. So, pharmacy, I can only speak specifically to pharmacy because that's sort of where my area of expertise is, but we are a very regulated industry, and we have to go by FDA and ACIP guidelines. And we cannot administer, even if we had a prescription from a doctor, we cannot administer a high dose flu vaccine to a patient that is under the age of 65. And that's nationwide. So if you were to come into a pharmacy and you were not 65, we would give you the quadrivalent vaccine. And in fact, even if you are over 65, CDC guidelines do not mandate that you get a high dose vaccine. So if for whatever reason that pharmacy is out of stock for the high dose, get a vaccine. You're better to get a vaccine than nothing is my point of view. But I am opening the floor to William and Iris as well, because you guys might have a different view.
Well, Tasha is exactly correct. An additional bit of good news is that if you're 65 and older and you get either the high dose or the adjuvanted vaccine, it will be covered by Medicare. So you don't have to worry about that. You just roll up your sleeve. You don't have to reach for your wallet. Now, to get to your question, and I'll be very interested to see what Iris has to say. I know that there are physicians who are administering either the adjuvanted or the high dose vaccine to people under age 65 in their own practices. Usually these are people who are immunocompromised in some way. They think if the vaccine works better for those people age 65 and older, perhaps it will give an extra boost, if you will, to people who are under 65 whose immune system is not quite as good. It's a very reasonable thought. As has just been said, the vaccine's not licensed for that. The Advisory Committee on Immunization Practices does not make that recommendation. And as far as I know, there are no substantial data to support that. So that's really a very distinctive off-label use of the vaccine. It would really depend on the individual doctor. So Iris, I don't know, are you doing things like that at Cornell?
No, I'm using the label use of the flu vaccine, not the high dose, unless my patients are older than 65, and I still have to go through a different set of hurdles even to get it at my institution. So it's just an extra click and an extra explanation or so forth. Nothing major. But I agree with you. I don't favor that even in patients with autoimmune conditions or that are immunocompromised because of medications or an autoimmune disease need to be getting the high dose. I will only give and recommend still just a regular dose of the inactivated vaccine.
Great. This is really fantastic information. I'll keep on with the questions. Just as a reminder to the audience, this webinar will be posted. So we apologize for the minor technical issues we've had in between. So, but we will post a recorded version as well, so you can always go back to the bits that you feel like you didn't hear quite well, and recap and refresh what you would like to learn more about. So the next question that comes in, actually, again, from 2 or 3 patients here, is about an egg allergy. We talked about the flu vaccine, and a lot of patients with autoimmune conditions often also have GI issues, allergies, etc. So patients ask, if they do have an egg allergy, what is the safe flu vaccine to take? And are these available both at doctors' offices as well as pharmacies? What should they ask for if they have an egg allergy? Any guidance on that from, and we can have all of you provide input on this. So maybe we can start with Iris, Dr. Schaffner, and then Tasha in the order that I'm seeing on my screen.
I'm gonna keep it simple, and it seems that William, you are very well versed in all these particular products. So I go sometimes with whatever agreement is in my institution with providers. But the amount of proteins from egg in the new vaccines is very low, and they did some studies where they gave this vaccine to people with a documented egg allergy, and almost none of them develop a serious reaction. Most of them have mild symptoms like any person without egg allergy would experience. But so there are also products that are without egg proteins, and they found that you could still have a reaction even with those, but it's not on the basis of being allergic to egg either. So bottom line is that you can, the risk of having some reactions, it's also there, but it's also like what happened if you're allergic to naproxen. You took that over the counter and then you are allergic to naproxen. So the same happened with some products that you might have not taken before, and not necessarily on the basis of having a vaccine on the basis of egg or with egg products, sorry. So recently doctors are not screening for people with history of egg allergy, as that is not something that will impede or contraindicate for an individual to receive the flu vaccine. William?
Thank you. So the only thing I would add to that very nice discussion is that there are some patients who over the years have been so concerned about their egg allergy that they are very concerned. They're anxious about getting vaccines made in eggs. And as Ira said, there are a couple of vaccines that are not made in eggs. One is made in cells, and another one we call Recombavax is not made in cells either. So you could use either one of those in those patients. Tasha?
Yeah, I agree. And you could use the vaccine finder to help you find that vaccine and who would have it at a location near you.
Right. Not every doctor's office will have the whole complement of vaccines. So you may have to hunt a little bit.
Yes, and that may be the case for pharmacies as well. And especially as the flu vaccine or the flu season, you know, as we start getting later into the year, there's only so much flu vaccine that is made by the manufacturers. And so once it's made, it's gone. And so that's why, getting your flu vaccine now is the time, because even though it's never too late to get a flu vaccine, if there's a high flu incidence in your area, let's say in February or March, and you haven't gotten your flu vaccine, go get a flu vaccine. But it's better to get it early so that you're protected ahead of time.
Now is the time.
Absolutely.
I think we'll all sing that in harmony.
That's right, exactly.
I have a question. I have a follow-up on that, William. So, have you given the flu shot to patients that are having egg allergy? I think our primary care clinic here does it all the time.
Well, I haven't personally, but that's because I'm a consultant ID doc. But certainly in our regular general medical clinics and the like, we give the flu vaccine to people who've had egg allergy. And just like all the studies, and there are a number of studies now done by the allergists that show that problems are really very rare. The people we're concerned about, the only people we're concerned about, are people who have had a vaccine and then have had some respiratory symptoms afterwards, difficulty breathing and, and those kinds of things. Probably not due to egg allergy at all, but those are the folks that we would be most concerned. And they are very few indeed, fortunately.
Yes, that's been our experience too. Thank you.
This is great. This conversation is so wonderful. It's not very often that we have three experts like you on the same screen, talking back and forth about such an important topic. So thank you very much. We have a little more time for maybe just two more questions. One, I think, really important one that we might want to address. We've heard a lot since the start of this pandemic about hydroxychloroquine. And patients are asking if they are taking that medication for their autoimmune condition, but that's rheumatoid arthritis or something else. Are they then protected from both COVID as well as the flu? Do they still need the flu shot in effect?
Well, I think that's an easy answer. Sure, they absolutely do. We're all nodding yes.
Yeah, so and go ahead.
That seems to be a unanimous yes. You still do need a flu shot even if you are on hydroxychloroquine. Is that correct?
Yes, that is correct. And the data that came from the Global Alliance for Rheumatic Diseases in COVID-19 show that patients on hydroxychloroquine, excuse me, were doing and were getting admitted to the hospital as frequently as people that were not on hydroxychloroquine and had severe COVID-19 presentations as well. So be mindful that this is something that the data has not been supported that it is protective. So you still need to wash your hands, get social distance, wear your mask, and get your flu shot.
Bravo.
Great. Wonderful. Tash, this question comes for you. So if I were to go into my local Walgreens or my pharmacy and I was to tell the pharmacist that I have been exposed to someone with COVID-19 in the last few days, is there a protocol? Will I still be given the flu shot, or will I be asked to see my doctor? Is there anything in place in terms of the safety protocols at pharmacies currently for a scenario like that, for example?
Well, we would definitely screen you for the symptoms with the fever, checking for fever, screen you for the symptoms. If you were having any symptoms, we would ask you to come back when you're feeling better. But if you were exposed yesterday, you're not displaying any fever, then more than likely you would get your vaccine, because you would be able to answer all the questions that are appropriate to vaccinate that day.
Great. So it certainly seems after this conversation, talking to all three of you, that there's very stringent protocols and procedures in place so that patients are taken care of, patients continue to stay safe and still get the care that they need, including the flu shot for this upcoming flu season. And thank you so much for that information. Unfortunately, we're coming to the top of the hour. I wish we could continue this conversation for another hour. I would happily keep you all three on, but unfortunately, that's not the case. We do want to thank you very much for an information-packed webinar today, which we hope provided much guidance and useful information to our patient population. A very special thanks, especially to our audience, for all the fantastic questions you've posed. We haven't been able to answer all of them, and we really are sorry about that, but we will get back to you with your questions. Be rest assured about that. We'll find a way to either email you or post additional questions on our website at www.creakyjoints.org. As a reminder also, and I keep saying this again because we want you to be able to share this webinar with others. We will be posting this webinar on creakyjoints.org, so feel free to, of course, share it with others in your circles. Needless to say, it's been a really tough year, and we want to do everything we can to support you through this year and through the upcoming months. And so we've developed at the Global Healthy Living Foundation a special and free patient support program for patients living with all kinds of chronic conditions, specifically during the COVID pandemic. So if you haven't already, please do consider joining this program. We answer questions like the ones that you've asked today on this webinar, and we provide updated evidence-based information constantly to our patient population. And you can learn more about this program by visiting us at www.ghls.org. That's www.ghls.org. So along with the flu season, we're also coming up on the holiday season, and we know this holiday season is going to be a more than usually difficult one for many of us. Please know that we're all thinking of you and your loved ones during this time, and we continue to be in this together. We started out together, and we'll get through this together as well. With that, once again, thank you so very much. Stay tuned for our upcoming webinars. Thank you to our panelists. Take care, stay safe, and have a good rest of your day.